Hello students, this is Perio, Chapter 27, Lecture 1. Supragingival versus subgingival irrigation. The objective of supragingival irrigation is to diminish gingival inflammation by disrupting biofilms coronal to the gingival margin. The goal of subgingival irrigation is to reduce the number of bacteria in the periodontal pocket space. A dental water jet is a device that delivers pulsed irrigation of water or other solutions supragingivally and subgingivally. It is also known as a dental water irrigator, home irrigator, or water flosser. The mechanism of action is a pulsating fluid is delivered that incorporates a compression and decompression phase. This creates two zones of fluid movement called hydrokinetic activity. The impact zone is the initial fluid contact with an area of the mouth. The flushing zone is the depth of fluid penetration within a subgingival sulcus or periodontal pocket. Here is an image of the impact and flushing zones of a water irrigator. Fluid penetration. The depth of penetration of a toothbrush underneath the gingival margin is 1 to 2 millimeters. Rinsing alone reaches 2 millimeters below the margin. Dental floss can go as far as 3 millimeters, but a dental water jet can penetrate 6 millimeters below the margin. The benefits of home irrigation are biofilm removal, bleeding reduction, gingival inflammation reduction, periodontal pathogen reduction, and reduction in inflammatory and destructive host response. Biofilm removal with a water jet. A microscope confirms that 3-second application of water pulsation at a medium pressure removes 99% of plaque biofilm from extracted teeth. There is the tooth surface before and after treatment with a 3-second pulsating spray at medium pressure. Indications for recommendation. Individuals on periodontal maintenance, individuals who are non-compliant with dental floss, so this is an alternative to traditional flossing. Individuals with special needs such as dental implants, diabetics, orthodontic appliances, and prosthetic bridge work and crowns. Examination with scanning electron microscope of chronic periodontal patients immediately following irrigation found no evidence of trauma or injury to the tissue. The incidence of bacteria is similar to other healthcare devices. Incidence of bacteria is similar to other healthcare devices, so before recommending a water jet to a patient who is at high risk for infective endocarditis, dental health care providers should consider both the patient's overall medical and oral health status. Consultation with a physician is advisable for patients at high risk for infective endocarditis. Irrigating solutions can be plain water, or water mixed with antimicrobial solutions, or antimicrobial solutions undiluted. Water as an irrigant. Simple tap water has been shown to be highly effective as an irrigant in numerous studies. Water has advantages as an irrigant in that it is readily available, it is cost-effective, and has no side effects. Chlorhexidine should be diluted with water for home use. It is available by prescription only. In the United States, the maximum strength is 0.12%. Essential oils are contained in Listerine and other products. They are only effective when used at full strength, and they are available over the counter. This is the standard irrigation tip, which is made of a plastic material. Subgingival irrigation tips have soft rubber-tipped ends. An orthodontic irrigation tip has a soft tapered brush that facilitates biofilm removal around orthodontic appliances. See the technique for use of irrigation tips in your textbook. At-home water devices using supragingival and subgingival irrigation may benefit periodontal patients. Pulse-setting devices have the ability to remove biofilm and reduce bleeding, gingivitis, and a number of periodontal pathogens. Professional subgingival irrigation. The in-office flushing of pockets is performed by the dental hygienist or dentist. Systems for professional irrigation include blunt-tipped irrigating cannulas, which are attached to a handheld syringe. It can also be used with an ultrasonic unit that is equipped with a fluid reservoir. There are specialized air-driven handpieces that connect to the dental unit. This is a picture of an irrigating cannula attached to a handheld syringe. This is a reservoir for an ultrasonic unit. The goals of professional irrigation are the disruption and dilution of plaque biofilm from within periodontal pockets. The irrigant solutions can be water, chlorhexidine, diluted povidone iodine in water, diluted stannous fluoride, tetracycline, and Listerine. The status of professional subgingival irrigation is very controversial. In-office subgingival irrigation with an antimicrobial agent has been shown to have only limited or no beneficial effects over periodontal instrumentation alone. However, it is popularly used to reduce the bacterial spray that can infect hygienists and people surrounding the patient that is being treated. Substantivity, that is the ability of a chemical plaque control agent to be retained in the oral cavity or in the pocket and be released slowly over time with a continued antimicrobial effect. There is no long-lasting substantivity of the antimicrobial agent due to the continuous flow of gingival crevicular fluid from the periodontal pocket. A substantive antimicrobial agent such as chlorhexidine gluconate would have to be retained in the pocket and be released slowly over time to have a beneficial effect. Subgingival irrigation performed before instrumentation may reduce the incidence of bacteremia and the number of microorganisms and aerosols. Currently, there is insufficient evidence to indicate that professional subgingival irrigation should be used routinely as a supplement in the in-office procedure. This concludes Perio, Chapter 27, Lecture 1.